Hello and welcome to this learning module. Today we will provide an overview of infectious diseases and the precautions we can take to protect ourselves from them. This video is intended to supplement any readings or coursework assigned by your instructor. The objectives for this learning module are: number 1, differentiate the terms infectious disease and communicable disease. Number 2, describe the methods of disease transmission. And number 3, list the standard precautions that must be taken to protect ourselves from infectious and communicable diseases. The World Health Organization defines health as a state of complete physical, mental, and social well-being. Health is more than the absence of disease. It's a complex interaction between physical, mental, and emotional conditions. Because these conditions are all intertwined, by improving our emotional well-being, we can improve our physical and mental health. The term wellness refers to the pursuit of activities, choices, and lifestyles that help improve our physical, mental, and emotional conditions. In healthcare, resilience is defined as the ability to bounce back from negative experiences. As EMS providers, we must maintain good health and wellness while also strengthening our resilience. Stress is how our bodies respond to a challenge or demand. When we are stressed, our body releases certain hormones that travel through our bloodstream and control how other parts of our body respond. Stress can cause an increase in our blood pressure, heart rate, and blood sugar levels. Not all stress is bad, however. A stressor that produces a positive response is called eustress. An example of this would be how we feel when we are driving and someone cuts us off. In this situation, the jolt of hormones helps us react quickly to the situation and avoid an accident. Conversely, distress is a harmful kind of stress that produces negative responses. This can include feelings of being overwhelmed, increased anxiety, and loss of focus. So how can we maintain good states of health and wellness while building our resilience as EMS responders? Well, there are actually several things we can do to help ourselves, and these include eating healthy, getting 8 hours of sleep each night, exercising regularly, avoiding alcohol, smoking, vaping, tobacco, and nicotine products, and building habits of mindfulness and positivity. In order for us to be able to take care of others in the best way possible, we must first ensure that we take care of ourselves. An infectious disease is a disease caused by microorganisms such as bacteria, viruses, and fungi that can cause a disease in the body. A communicable disease is an infectious disease that can be spread from one person to another. In the image on the left, we see the viral pathogen that is responsible for COVID infection. In the image on the right, we see aerosol and droplet particles emitted by a sneeze. If the person in this image has these COVID viral particles in the aerosol or droplets, the disease could be transmitted to another person. Not all infectious diseases are communicable. For example, Lyme disease is an infectious disease caused by a viral pathogen that cannot be spread from person to person. Generally speaking, there are 4 ways that diseases can be transmitted or spread: contact, airborne, foodborne, and vector-borne. Diseases can be transmitted by direct or indirect contact. Diseases that are transmitted by direct contact happen when the pathogenic organism is moved from one person directly to another without any intermediary. An example of this might be a bloodborne pathogen such as hepatitis B, which can be transmitted directly from contact with an infected patient's blood into an unprotected cut or wound on a healthcare provider. Indirect contact involves the spread of infection from one patient to another through an inanimate object. For example, recent research has implicated that oxygen bottles that are not properly cleaned between patient contacts can be a means of transmission for methicillin-resistant Staphylococcus aureus, or MRSA. Another example would be the transmission of hepatitis C from an infected person to another by sharing a needle to inject illicit substances. Airborne disease transmission involves spreading a pathogen through the air as droplets or aerosol. For example, coughing and sneezing are common methods of airborne transmission. Common airborne pathogens include COVID, the flu virus, meningitis, and tuberculosis. In the image on the screen, we see that the transmission cycle of COVID can be airborne, direct, and/or indirect contact. As the name implies, foodborne transmission involves the ingestion of contaminated food or water that contains a microorganism that can cause disease. An example of this would be hepatitis A, which is a foodborne infection. Lastly, vector-borne transmission includes the spread of infection by a vector that can be an insect or animal that carries an organism from one person or place to another. Examples of vector-borne diseases include rabies and Lyme disease. Later in this presentation, we will discuss how we can protect ourselves as EMS responders from infectious and communicable diseases. According to the CDC, the preferred term for infection control precautions is standard precautions. Standard precautions are the basic practices that apply to all patient care, regardless of the patient's suspected or confirmed infectious state, and apply to all settings where care is delivered. These practices protect healthcare providers and prevent infection transmission to other patients. As a new EMS provider, you may hear other infection control terms used by experienced providers. Body substance isolation, or BSI, and universal precautions are outdated infection control terms and practices that older providers may use. To best protect ourselves, the CDC's standard precautions are the infection control practices that we must follow. According to the CDC, standard precautions include 6 components, and we're going to review each one. When working in the field, EMS providers do not routinely have access to soap and water. Instead, we should be using an approved alcohol-based hand sanitizer before and after contacting a patient and immediately after glove removal. Once it is feasible, we should then wash our hands with soap and water. Cleaning and disinfection of equipment and surfaces that come in contact with the patient or were in close proximity to the patient should be completed after every patient contact and/or transport. Cleaning removes dirt, germs, and soiling from surfaces and objects, while disinfecting uses chemicals designed to kill germs that remain on surfaces after cleaning. Surfaces should be cleaned before disinfecting because dirt and other impurities can make it harder for the disinfectants to work. The next component is to ensure injection and medication safety. As EMTs and paramedics, we need to use extreme caution when administering medications by injection. Throughout your training, you will be taught how to use aseptic technique when preparing and administering medications. EMS providers must take caution to ensure that accidental needle stick injuries do not occur. Another component of standard precautions includes performing a risk assessment on each patient and selecting the appropriate personal protective equipment, or PPE, required for this patient contact. For example, we know that we will use gloves on every patient contact, but if we suspect the patient has an airborne disease such as tuberculosis, we will also want to wear an N95 respirator mask to protect ourselves. We will talk more about PPE selection on the next slide. EMS providers play an important role in the next component, which is minimizing potential exposures. If we are transporting a patient to the hospital that we believe has an airborne communicable disease, it's important that we notify the receiving facility so they can prepare for that patient's arrival. For example, if we're bringing in a patient we suspect has COVID, the emergency department is going to want to set up an isolation room so that other patients are not at risk for exposure. This component also includes using respiratory hygiene and cough etiquette to reduce the transmission of respiratory infections. Lastly, any equipment that is not disposable must be properly cleaned and disinfected or sterilized. This can include items such as blood glucose meters, pulse oximeters, blood pressure cuffs, and our stethoscopes. Sanitizing wipes are available in the ambulance as well as at the hospital to ensure that these items can be properly disinfected prior to the next patient use. In the image here, the white and gray collar on the patient's neck is a single-use disposable cervical collar that should be discarded after use. On this slide, we see a list of commonly used personal protective equipment that should be available to EMS providers. With the exception of eye protection such as goggles, all the PPE listed here are disposable and should be discarded after every use. Gloves are the most commonly used PPE by EMS providers, and it's recommended that you always carry a couple of extra pairs in your pocket while at work. We wear gloves when it can be reasonably anticipated that contact with blood or other potentially infectious materials, mucous membranes, non-intact skin, or contaminated equipment may occur. When gloves get soiled, they should be removed and replaced with clean gloves. When responding to a trauma call, you may want to consider double gloving your hands so that if one pair gets heavily soiled, you can simply remove them and you have another pair ready to go underneath. On calls where splash protection from blood or other body fluids is needed, disposable gowns are recommended to protect skin and prevent soiling of uniforms or clothing. Additionally, the use of protective eyewear and a mask or face shield, as seen in the image here, protect the mucous membranes of the eyes, nose, and mouth and are also recommended when splash protection is necessary. Please do not use the same gown or pair of gloves for care of more than one patient. Remove and discard disposable gloves upon completion of a task or when soiled during the process of care. The N95 respirator is the most common type of particulate filtering face piece respirator. This product filters at least 95% of airborne particles but is not resistant to oil-based particles. N95 respirators must form a seal to the face to work properly, and wearing an N95 respirator can make it harder to breathe. If you have heart or lung problems, the CDC recommends that you talk to your doctor before using an N95 respirator. Your agency will properly fit test you for an N95 respirator and will provide you with the brand and type of masks that you are fitted for. If your agency changes the N95s available to you, you will need to be refitted to ensure the new masks will properly protect you. Your agency will also provide training on proper donning and doffing or removal of your N95 respirator. A respirator labeled as a KN95 respirator is expected to conform to China's standard only. The National Institute for Occupational Safety and Health, or NIOSH, does not approve KN95 products or any other respiratory protective devices certified to international standards. The image on this slide illustrates how you can tell whether an N95 mask is NIOSH approved. Engineering controls are designed to control the hazard at the source before it comes in contact with the worker through isolation or enclosure of the process. They are often built-in parts of the device or equipment. Examples of engineering controls include exhaust ventilation in the patient compartment of an ambulance, safety engineered devices such as needleless device systems and self-sheathing scalpels and lancets, equipment guards, and sharps containers. In the image on the left, we see several different sizes of sharps containers. Administrative controls are changes in work procedures to reduce the duration, frequency, and severity of exposure to hazardous chemicals or situations. Administrative controls include work practice controls, which are intended to reduce the likelihood of exposure by changing the way a task is performed. Examples of administrative controls include provide for medical surveillance, vaccination, fit testing, and appropriate selection and availability of PPE, train and educate employees about the proper use and disposal of PPE, as well as surface disinfection and cleaning practices, and make written health and safety policy and procedure manuals available. In the image on the right, we see a provider being fit tested for an N95 respirator mask. The Occupational Safety and Health Administration, or OSHA, defines an exposure incident as a specific eye, mouth, or other mucous membrane, non-intact skin, or needle stick contact with blood or other potentially infectious materials that results from performance of a worker's duties. If an exposure incident happens, you will need to transfer patient care to your partner and take steps to limit that exposure. This includes things like washing an exposure site with soap and water, flushing your eyes with saline solution, or rinsing your mouth with an alcohol-based mouthwash. The exposure needs to be reported as soon as possible to your supervisor and agency infection control officer. The information they will need includes the date, time, and source of the exposure, as well as any additional details that you can provide. Part G of the Ryan White HIV/AIDS Treatment Extension Act of 2009 outlines requirements for the notification of emergency responders when exposed to a disease on the NIOSH list of potentially life-threatening infectious diseases. These include diseases such as Ebola, COVID, rabies, tuberculosis, and meningitis. Notifications about emergency responder exposure can occur in one of two ways. Number one, the medical facility determines that the victim of an emergency has a potentially life-threatening airborne or aerosolized infectious disease, and the emergency responder should be notified to seek follow-up assessment and care. Or, Number two, an emergency responder who treated and or transported a victim believes that they have been exposed to an infectious disease on the NIOSH list and requests information from the medical facility. If you believe you have experienced an exposure incident while caring for a patient, you must notify your agency's designated infection control officer to initiate a request for notification from the medical facility where the patient was transported. They will contact the receiving facility to determine whether there is a potential pathogen exposure. If the receiving facility's infection control officer determines that the source patient has a disease that could be transmitted due to that exposure, you will be notified for follow-up care. All EMS agencies are required to have a current infection control plan. It is the employee's responsibility to know how to access the plan in the event of an exposure incident and to report the exposure accordingly. So here are the references and resources used in the development of this presentation. This brings us to the end of this presentation. Here we see the learning objectives for this module. Can you demonstrate each of these objectives? If not, please consider going back to review any content that you might have struggled with. Thank you for watching this learning module.